But at the moment, Shankara, with regards to your numbers, and I'm saying this because I know how important it is for this number, you've seen over 6,000 patients now in rural, semi-rural South Africa. Have you had any deaths?
No, Philip. When we talk 6,000 patients, I've abandoned the PCR test a long time ago. So I tend to count those patients who come back on the 8th day. The rest are just colds and flus. So the patient comes back on the 8th day with worsening, is considered a positive, whether I test him or not. So yes, I've seen over 6,000 patients. We haven't had any hospitalizations. I haven't had any deaths. And I've seen some critically ill patients, but I've managed to negate the need for oxygen as well. Like I mentioned with promethazine, we see a very quick, within hours, a rebound of hypoxia. I've had patients present with a 70% saturation with a stat dose of promethazine intramuscularly. I've seen that go up to 85% within 4 hours. So a majority of my patients were no more breathless within a day or two. So my practice still doesn't have oxygen supplementation. So I think the big concerns is the oxygen, the hospitalizations, and the deaths. And appropriately treating can curb all that completely. I've had some really critically ill patients. I mean, I had a lady come in 2 or 3 weeks ago with a saturation on oxygen brought in by an ambulance from her home with an oxygen sats on 5 liters of oxygen of 54%. She was on her 13th day. I did her D-dimers and the rest. Her CRPs were in the 400s. So too her interleukin 6s. And I started this protocol, called her back 3 or 4 days later. She came in tow with her local GP because he was amazed at what had happened. Her oxygen had improved over those 3 days to 88% on room air. We did her biomarkers. They showed a drastic decrease, both into the hundreds. But a D-dimer had went up from 1.2, I think, to 68. I think other countries use 500 and below as the norm. So this would have been 68,000. Her GP almost fainted when he saw that, wanted to put her on oral injectable anticoagulation, but I advised him on Xarelto. 4 days later, her CRPs were normal, her D-dimers were 4, and her interleukins were normal. So we were working towards weaning her off steroids, getting her off the Xarelto, and she was saturating at, if I remember correctly, 96% of oxygen within a week, at 54% to start on oxygen. So it worked well if you monitor and manage it well from the start, catching it early, being aggressive, and then you can wean the patient off medication relatively easily.